Perfect. All right. So I think that everybody has seen the welcome in the chat box. And Christine, I'm so sorry. Now there's another gray bar in the middle. Okay, it's gone now. Now you're so welcome everybody, and we are so excited to have you here at our Reach Out and Read Oregon 2021 event, Reading Relationships and Resiliency. Just a couple of quick welcome and virtual housekeeping community norms for us. Everyone could mute when they're not speaking so we don't run into any issues. And also please join us on video as you're able. It would be great for folks who are able to rename themselves so that we can see your organization's name in addition to your name. And then if you are on the phone, we are so glad that you are here. And anytime you want to mute or unmute, just hit *6. And we'll be using the chat box throughout as we have discussion and Q&A. And there's several of us who are working as co-hosts to be able to address any issues and as they come up. So I am really excited. My name is Brina Klaas. I am our Reach Out and Read Chief Operating Officer, and I have the great privilege of working really closely with our amazing Reach Out and Read Oregon team and community. And it is a great pleasure to introduce our wonderful executive director, Samira, who is going to take it from here.
Thank you, Lembrina. Welcome, greetings. Welcome to the second annual event of Reach Out and Read Oregon. We are honored by your presence and grateful to have all of you with us in celebration, partnership, and community. We hope you and your loved ones are staying safe and healthy and want to extend special gratitude to those here today that provide direct and essential services to our community. I want to call out to my wonderful team at Reach Out and Read Oregon, our medical director, Kate Clayton, program specialist, Tristan Dreves, and development coordinator, Christina Putterman. Thank you, team, for your hard work and passion over the past year to ensure that the tens of thousands of children who participate in Reach Out and Read across the state each year continue to do so during these unprecedented times. Second slide, please. I also want to thank many foundations, the health systems, community partners that support our work and make it possible for us to provide Reach Out and Read across the state of Oregon. In addition to the programs on the slide, I would like to express my gratitude to the Early Learning Division, the Early Childhood Coalition, and our consultants, Lauren Garrett and Kylie Bruno, who have helped us navigate the current legislative session. And now, before we begin our program, I want to briefly introduce Reach Out and Read to those of you joining us that may be hearing our name for the first time. As you see on this slide, Reach Out and Read is made up of a three-part model. At every well child visit, starting at the 6-month visit through the 5-year check, children will get new books to take home and parents will get advice and support relevant to their child's developmental stage, giving them the tools and instructions for how to make reading part of their daily routine. Books are available in many languages to ensure that parents can utilize them at home, whatever language they might speak. If there are specific languages that your patient population speaks, please let me know so that we can help support the book ordering process for those languages. As a result of this three-part intervention at the medical provider's office, parents become more engaged and read to their children more often at home. Parents incorporate advice received through pediatric visits and making reading a loud part of their daily routine. Our families read up to 350 hours with their children prior to kindergarten. I'm now going to hand it over to Dr. Kate Clayton, our medical director, to introduce today's keynote speaker. Kate?
Okay, thank you, Samira. I am grateful for the honor of introducing Dr. Philip Fisher. Dr. Fisher is Philip K. Knight Chair and Professor of Psychology at the University of Oregon, where he serves as founding director of the Center for Translational Neuroscience. He's also a senior fellow at the Center on the Developing Child and a member of the National Scientific Council on the Developing Child, both based at Harvard University. His research, which has been continuously funded by the National Institutes of Health since 1999, focuses on developing and evaluating scalable early childhood interventions in communities and on translating scientific knowledge regarding healthy development under conditions of adversity for youth in social policy and programs. He's currently the lead investigator in the ongoing Rapid EC project, a national survey on the well-being of households with young children during the COVID-19 pandemic. Dr. Fisher is the developer of a number of widely implemented evidence-based interventions for supporting healthy child development in the context of social and economic adversity, including treatment foster care Oregon for preschools, kids in transition to school, and filming interactions to nurture development. He's published over 200 scientific papers in peer-reviewed journals. He's a recipient of the 2012 Society for Prevention Research Translational Science Award and a 2019 Fellow of the American Psychological Society. Thank you so much for being here, Dr. Fisher. I'm going to give you the floor.
Thanks so much, Kate, for that nice introduction. And thanks everybody for joining. I've done a lot of webinars since we all went remote at the beginning of the pandemic on Zoom. And I always appreciate doing one that's local here in my home state of Oregon. So it's good to see you all who are joining from Oregon and potentially Southwest Washington. And I will kick things off by getting my slideshow set up and going. Great. Can I just have somebody give me a thumbs up that they can see the slides?
Yes. We got
Great,
you.
thank you. Great. All right. Well, this is an especially exciting event for me because of a number of things. First and foremost, my partner in crime who's going to be joining for some discussion and banter after my presentation, Dr. David Willis, and I have known each other for a long time. And he has been instrumental in really focusing a lens on early childhood, not only in the state of Oregon, but also more generally at a national level, and continues to do so with a particular emphasis on relational health. I'll be talking more about that, but I'm just really excited to have an opportunity to share the virtual stage with him. Also, as David has been emphasizing for a long time, the pediatric healthcare system has long been I think an under-recognized, incredibly valuable resource for supporting not only children, but families with young children in the context of early learning and development. I think as nationally we begin to shift in ways that are really exciting to emphasizing early childhood, indeed understanding the potential that the healthcare setting has for promoting health and well-being in children and households in ways that are very holistic and not just focused on physical health, I think is something that we're going to be hearing a tremendous amount about. And Reach Out and Read has really an instrumental place in that transition that's happening in healthcare because it has long envisioned the primary care setting as a place where not only children's physical health can be facilitated, but also early learning can be really given a big jump start from the get-go in the interactions between parents and children and healthcare practitioners. So all of those things make me really glad to be here. What I'm going to be sharing about today is what was mentioned by Kate at the end of her introduction, which is information from a survey that we started conducting a year ago, last April, in order to really understand what was happening in the context of the pandemic and households with young children. As we come up on a year of data collection, we've learned a tremendous amount. And really, as this slide indicates, what it's done more than anything is given us a strong sense that our project has been bearing witness to and amplifying the voices of households with young children, and more recently of providers, childcare providers, not only to make sure that their voices are heard by all, but especially that their voices are heard by policymakers and advocates for children and families. Our RAPID project, which is the name of the survey, is really supported by an incredible cast of characters, both in terms of advisory boards that we have for both the household and now the new childcare provider survey that have been chaired by Joan Lombardi. And you can see a number of other really key people in the field of early childhood, as well as a policy working group that's had a huge impact on the content of what we're asking and on the dissemination of information. And I want to note, and I think this is very consistent with how many of us are now thinking, that this is not just a bunch of researchers or a bunch of people with a particular and single focus, that we have parent voice, we have provider voice, we have advocates, we have funders, we have people in government. Sadly, we have had Miriam Calderon, the director of the Early Learning Division for the state of Oregon. Sadly, I say, but for the country's benefit, who's moving to position in DC, and a number of other people who have really informed how this has kind of panned out. We're really grateful to our funders, and we have a number of partnerships that are relevant in terms of, again, where we recruit from, in terms of households and providers, and also how the information gets out. In particular, I want to note a very important collaboration we have with the Riser Network, which is a group of a network of Black child development researchers who are focused on addressing issues of structural racism and inequality in early childhood, and who have had a tremendous impact on and collaboration with this particular survey. So in a nutshell, what the rapid survey process involves is an ongoing survey. The household one focuses specifically on households in which there's at least one child, age 5 and under. It's national in terms of its scope. So we have participants from all 50 states, including many from here in Oregon. Also very diverse in terms of income, as well as race and ethnicity. We administer the survey over the internet. So it's required that you have some kind of smartphone with cell service, not high-speed internet or anything like that. Can be done on a phone, tablet, or computer. Takes about 15 minutes, can be done in English or Spanish. We aspire to be able to offer it in more languages, but our funding and sort of capacity hasn't allowed that to date. When we launched it initially, after about a month of feverish planning, it was going out every single week. Starting in July, we shifted to twice monthly, and it's been twice monthly ever since. We actually are closing in on 10,000 families total that have participated over the course of 47 surveys. We also, and I will be alluding to this, you saw this on our first slide, in the context of the survey, have not only been asking people to answer questions on, like 1 to 5 scales or yes and no, but also have been asking open-ended questions. What are the things that are helping the most? What are the biggest challenges? What would you like your policymakers and elected officials to know? And we've actually now exceeded 120,000. We're closing in on 140,000 responses to those open-ended questions, which is just a sign of how eager families are to share their experiences with us. This link here, and we'll be able to make the slides accessible after this presentation. You can read our postings on the medium.com website. There have been a number of them. And you can also see the fairly extensive media coverage that this data has gotten over the course of the last year. The survey itself focuses on the household survey on 5 topics. And so we've asked a lot about parent and child emotional well-being over the course of the pandemic. We started asking basic questions about income and employment, but through our various partnerships, especially with the Urban Institute, realized that it was much better to ask more generally about material hardships, difficulty paying for basic needs like food, housing, and utilities. We've asked a lot of questions and really come to see childcare as another space, just like healthcare, where there's a huge amount of intersectionality in terms of the workforce and the well-being of providers as well as families. And then, very germane to this talk today, we focused a lot on pediatric healthcare, including the extent to which people have been able to participate in healthcare in general, pediatric preventive visits, routine vaccinations, things that have prevented them from accessing, and so forth, as well as understanding about adults and their feelings about their children getting COVID vaccinations. As I said, we just came up on a year, and our most recent posting on medium.com describes the findings over the year of the pandemic. It's a really powerful piece, and at least from my perspective, in terms of how much we've learned as these 12 months have kind of gone by. In some ways they've crawled by, and in some ways they've flown by. So let me start presenting some of our findings related to the survey. So the first one that again, I think is very relevant to today's conversation, has to do with how pediatric healthcare has been affected in the context of the pandemic. In our survey, what we found when we ask parents, have they missed any kind of healthcare for themselves or their family during the pandemic? 84% approximately are saying, yes, we missed some form of healthcare, we had to delay it or skip it altogether. Equally noteworthy, I think, here is that we see that in terms of well child visits, almost 1 in 2 families, 40%, have reported that they missed a well child visit or a well baby visit. It's noteworthy that the majority of well child visits and well baby visits being missed in our sample, which remember only goes up to age 5, are the ones at the older age group, so the 3, 4, and 5-year-old. There are fewer that are being missed in infant and toddlerhood, but still a sizable proportion. And in terms of routine vaccinations, that there have been less reporting of that, but still a significant amount of not getting vaccines, scheduled vaccines on time during the pandemic. The other thing that is really noteworthy, and I think we'll probably want to talk more about this after I'm done with the presentation, is that households with a special needs child in particular have had major interruptions in healthcare. Getting to the doctor has been more challenging, and as a result, more have missed scheduled well child and preventive healthcare visits as well as vaccinations. We're very concerned about this because healthcare is one of the best places where children with special needs not only get identified, but then get systematically evaluated for developmental progress they're making and get referred to services. So this is clearly an area that needs additional attention. I do want to note, and I'm sure that others from Reach Out and Read will make this clear, that Reach Out and Read has a much better track record than the national kind of averages in terms of participation in pediatric healthcare during the pandemic. And it's no wonder, given the connections made with families, that there would be less interrupted healthcare among Reach Out and Read households. The next big takeaway from our data so far is that difficulty paying for basic needs, that is material hardship, as I described, is really at the root of a lot of difficulties. So the first thing I want to note is just the pervasiveness of material hardship in households with young children. When we started collecting data, 1 in 4 families reported that they couldn't pay for food or for housing or for utilities or childcare or healthcare. Over the course of the time that we were following families, we saw that number go up to much higher, 1 in 3, and even higher than that. And in particular, during the early months of the pandemic is where we saw a lot of increases as people's jobs were lost and people's financial circumstances changed dramatically. Through the midsummer, the rates of material hardship actually kind of leveled off and remained pretty steady around 1 in 3. That was a bit of a surprise to us because it was during this time that the CARES Act ended. And so people who were receiving pandemic unemployment no longer were getting that supplemental income. But I think we sort of saturated where the proportion of families that were really kind of flying without a net financially was at by the time we reached midsummer. And then quite interesting and somewhat promising is that since the beginning of this calendar year, we've actually seen rates go back down to where they were around when we started collecting data. I want to note this trend looks really positive. We're still talking about 1 in 4 families with a child under age 5 nationally, which represents many millions of children that are having difficulty paying for basic needs. The second piece of this story that's equally important is that the more difficulties you're experiencing financially, the more difficulties you're having emotionally. And you can just see this in very clear terms from these 2 graphs. This just shows a listing of the number of material hardship areas that parents are reporting. And so, do you have no material hardships? Do you have 1, like you're just having difficulty with utilities? Do you have 2 or 3? And just like for people who are familiar with ACEs, the more ACEs you have, the bigger the challenges. Similarly, we're seeing that during the pandemic, the more areas in which you're having difficulty paying for basic needs, the higher the reports you have, and this is on a scale of 1 to 100 from a measure that we compute, the higher your emotional distress will be, but also the higher your child's emotional distress will be. And that's a big cause for concern. A bit of a bright spot in our data is that in spite of very clearly documenting not only the relationship between material hardships and caregiver and child emotional distress, and the idea that these things actually unfold across time. So if you're having difficulty making ends meet and we check back with you in a couple of weeks, you're going to be more upset. And then if we check back with you in a few more weeks after that, you're going to say your child is having a harder time. So this chain reaction of hardship that we described, the bright spot is that we've consistently found that when people report higher levels of emotional support, it really helps to break the links in this chain. And people do better in spite of financial and material hardship when they report higher levels of emotional support. I've listed emotional or relational health here, not just because David Willis is co-presenting with me, but actually one of the surprising findings, maybe David would say not surprising, in our study is that when we looked at emotional support and we asked people, who are you turning to for emotional support in your life right now? What people said is that before the pandemic, not surprisingly, they mostly relied on friends and coworkers for emotional support. During the pandemic, it shifted to be much more local. So it was much less friends and coworkers. It was more family members and neighbors, people who live very close to you. But also, it was in particular, their very young children. And the idea that not only do adults support the well-being of young children, but that young children can support adults' well-being, I think is a really powerful example of how relational health can be bidirectional and really help in the context of the kinds of challenges that people have been facing to mitigate some of those effects. Why is this important? Well, I won't spend a lot of time on this during this presentation today, but at our center at the University of Oregon, the Center for Translational Neuroscience, and in work that many other researchers have done for many decades, we know very clearly that the kinds of experiences that we're seeing in this chain reaction of hardship can really amount to what's been defined as toxic stress. And I'll explain why. But people have, I think, come to use this term of toxic stress to relate to all kinds of things that we would not really fit the specific definition for which it was originally developed at the Center on the Developing Child. The way we define toxic stress is that experiences that activate the child's biological stress response system, which is exactly what should be happening. So when you have a stressful experience, all these systems come online. But to the extent that they come online and stay online because the child is experiencing ongoing and chronic stress, that signals some concern. It's especially a concern when there aren't adults who are able to help buffer the children and help them regulate these biological responses, because when children are very little, they don't have the physical maturation to be able to have the systems regulate on their own. So they depend on nurturing relationships with adults. Doesn't have to be a mom or a dad, but they need a meaningful relationship in order to be able to buffer them. And so when we see adults who are experiencing severe difficulties making ends meet, and they're saying they're stressed out, and then they're saying that their children are stressed out, we worry that children being stressed out in the presence of adults who are too concerned, or at least very concerned about their basic necessities, could really signal challenges that could not only just be present during the pandemic, but could transcend it and really lead to long-term impacts on health and well-being. And now we're not just talking about cognitive development or social emotional development, but even things like physical health. Okay, next topic that's been very clear, and this has just shown up in so much data, not just ours, is that structural inequalities that existed based on race and ethnicity that were longstanding in our society have only gotten worse during the pandemic. And so here you can see the rates of material hardship across time broken down by the Black households in our survey, the Latinx households in our survey, and white households. White households, much lower rates of material hardship across time. Again, not insignificant, 1 in 4. But in Black and Latinx households, we've seen numbers go much higher.
Everyone could mute if you're not speaking. And we'll get you. Okay, I think we did. Sorry about that.
No worries. Much higher rates of material hardship that have persisted across time in both Black and Latinx households. One thing that I'll point out in particular is that actually the improvements we've seen since January in Black households has not been matched in what we've seen in Latinx households. And although we don't have data to explain this, the possible explanations that have been offered may be that Latinx households have been more negatively impacted by job loss, even as the economy recovers, and also that availability and access to federal financial relief either has been harder to come by, or that because of fear related to immigration issues that have come into play in the last few years, that even willingness to interface with governmental systems may be less. So I just want to point that out. It's noteworthy in terms of structural inequalities. Also, what we see in terms of when we do segmentation by income, that in the lowest income groups, across all 3 groups on these red lines, you can see that the rates of material hardship are relatively equivalent. But as you go higher up in income, 200 to 400% of the federal poverty level or above 400%, really what you see is that there are fewer white households that are experiencing material hardships. But even when you get to above 400%, you're still seeing considerably more Black and Latinx households. These are rates of income before the pandemic. So these are households that were doing better before the pandemic. And among Black and Latinx households, we can see a lot that have really struggled with material hardship during the pandemic, even though they were doing better before the pandemic. Some of this may have to do with the wealth gap that's well documented to exist among households and people of color in this country. Some of it may have to do with supporting extended family members who are in need, and some of it probably has to do with, even if they were higher paying jobs, that they were less secure than jobs held by white parents with younger children. You can also see this in those open-ended responses that I mentioned before. You can analyze all of our open-ended responses and develop a list of themes that are commonly occurring in the statements that people make using an advanced kind of analysis tool for analyzing text. When we look at the concerns, we ask people, what are the biggest challenges that you're facing? And we see the concerns that are listed by white households. They mostly have to do with lockdown-related issues and social deprivation, missing family, isolation, worrying about your older kids, sleep problems, anxiety. When we look at the concerns that were raised by Black households, it's much more around basic necessities, basic needs, debt, house and car problems, paying expenses. Really a powerful example of 2 different pandemics playing out. Last but not least, I just want to emphasize that as we've started to collect data on childcare providers around the country, we're seeing very similar kinds of things play out. So the rates of material hardship that we're currently seeing among childcare providers, 45%, and those numbers are actually increasing. They're comparable to what we've seen in the households of young children, but whereas the young children's households are getting a little bit better, that's less true in terms of providers. And again, structural inequalities in terms of providers' reports of material hardship, the proportion of Black households that are reporting material hardship is higher than Latinx households, which is in turn higher than white households. These differences are right now not statistically significant because the survey is just getting up and running, and so the numbers are relatively small. But if these trends continue, they will quickly become significant differences. So I'm going to just finish with a set of recommendations, and then we'll shift to more of a discussion. First and foremost, I think one of the things that we're clearly seeing, and there is some reason for hope, I think, in some of the plans that we see coming out of Washington, D.C. with the child tax credit and the American Rescue Plan. Nevertheless, I think we're clearly needing to remain vigilant around focusing on what families and providers need so that children can be as healthy and as prosperous as possible. And so first and foremost, clearly financial stability and relief from material hardship are at the root of what we're seeing. And we're hoping that some of the financial relief that's coming in will make a difference. I want to note, we've observed large quantities of debt in our households that have accrued during the pandemic, much more than were there beforehand. So we shouldn't expect financial relief to make a difference right away. If anything, it's going to take some time and probably sustained relief, not just a shot in the arm here or there. Second, and this is where Reach Out and Read comes in, integrated services is incredibly important. The intersectionality of services that promote health, that promote behavioral health, housing, and education. Really, we've been saying for some time that these things need to be brought together, that families need help navigating them. There's no better place than the pediatric healthcare system in which that process could begin and the integration could occur. Emotional support as a buffer to promote relational health, both formal and informal, will be critical in an ongoing manner. And then lastly, we are strongly advocating for people to recognize that families need time, that parents need time, and providers need time. They need time not only just to be able to have quality of life, but in terms of policy, they need time so that when they're sick, when their loved ones are sick, that they can take time off without worrying about loss of income, that when there are new children in their lives, that there's somebody at home to take care of children. So time is the fourth kind of cornerstone of what we're talking about. I want to note that Reach Out and Read and programs like it have clearly been a critical lifeline for families during the pandemic and will continue to be, continue to be as we kind of move forward. And I think it's essential that we recognize that this will continue to be a need in the future, and a big way that we can really promote well-being. Second, I want to note that here in the state of Oregon, that as we begin to think about kindergarten readiness and learning loss that have occurred during the pandemic, that we can look at programs like Reach Out and Read for helping to make up some of that lost ground and perhaps to have already kind of mitigated some of that learning loss. And then last, I just want to note that, again, there is huge opportunity for innovation in early childhood development. And when we think about platforms in which that can happen, they need to be platforms that are already out there and serving large numbers of households. And so I think this is a great example of a place where really novel things can happen. Okay, I will stop there and stop sharing my screen and turn things back over to the moderators.
Right. Thank you so much, Dr. Fisher. That was just a very important talk, and great to hear all of that information. Really quickly, we wanted to open it up for any questions for Dr. Fisher before we move on to the panel discussion with Dr. Willis. There was one clarification, Dr. Fisher. When you're saying providers in your studies, you're meaning childcare providers, correct?
I should have remembered the audience. Yes. There's different terminology. Yes. So we're talking about childcare providers in terms of the survey. Although I will say we're very interested in a healthcare provider survey as well for the same reasons, because we want to understand how healthcare providers are doing relative to being able to serve families, and also just how they're doing balancing the challenges of the pandemic.
Mm-hmm. Great, thank you. If no one has any other questions, then I'll hand it over to Samira real quick to introduce Dr. Willis.
Well, you're muted, Samira.
Yeah, I was following instructions. I was muted. So
Thank you for modeling. That's great.
thank you so much. Any other last call? Any other questions? So thank you so much, Dr. Fisher. That was very informative. And everyone who are participating today. We're now going to pivot to a panel discussion between Dr. Fisher and our next guest, but I believe Dr. Willis is on, and our next guest was Representative Lisa Reynolds, and she is currently in active session and will join shortly, but I'm gonna go ahead with Dr. Willis's bio. Dr. Willis is a senior fellow at the Center for the Study of Social Policy, where his focus is on the intersection of child health and broader community-based early childhood systems. Before joining the Center for the Study of Social Policy, Dr. Willis had previously been the executive director of the Pervasiveness Fund, where his work was focused on the promotion of early relational health, the strengthening of the social and emotional development, and advancing the field of infant mental health. A developmental behavioral pediatrician, Dr. Willis was a clinician in Oregon for more than 30 years, with a practice focused on early childhood development and family therapy. Prior to his work with the Pervasiveness Fund, Dr. Willis served as director of the Division of Home Visiting and Early Childhood Services at the U.S. Health Resources and Services Administration, Maternal Child Health. And for us, Dr. Fisher is also a Reach Out and Read Oregon's advisory committee member, and he is our guiding light. So thank you so much, Dave. Please carry on. And when Representative Lisa Reynolds joins us, then we will continue with her introduction then.
Fabulous. Thanks, Samira. Hello, everybody. And Phil, thanks so much for the reality of the information that's in front of us about families. It's so exciting that the funders have come together, as well as so many of your thought leaders, to chronicle the experience that families have been having and to make that visible over time. And one of my first questions is, I hope that survey process is going to continue, because the world around young families is continuing to shift and change. And to actually be able to monitor, if that's the right word, as best as we can for the lives of families communicated in this way, seems to be incredibly important at this moment. And I hope you're going to be able to say yes, that work will continue at this moment.
Absolutely. Very excited. I mean, if you can just put in a good word to our funders, we're eager to continue it indefinitely. But I do want to note just really quickly, when we started, we thought we were going to be bearing witness to the pandemic. And, you know, there was a bit of a shift around the beginning of the calendar year, where we realized that we didn't necessarily need to be talking about catastrophe and tragedy in the same way that we had been focusing on, that we really needed to set our sights on the future. And I think what we're seeing now with this groundswell of focus on early childhood is that there's no way that we can take our eyes off of the challenges that households are facing, but also that we are now in a position to document how things can move forward in a way that has really given us a unique opportunity right now in this historic time to really focus in on the needs of households with young children and those around them. So yes, the plan is to continue and actually to not only have it be national, but then we're very interested, and we're in discussions now with a number of communities that are interested in using this tool as really a way of amplifying the voices of those around young children in their communities as new policies and so forth get put in place.
Yeah, it's phenomenal. A couple of other thoughts I had. Is the sample of the same families over time?
We get that question a lot. It's a great question. The survey, when we launched it, we didn't want the perfect to be the enemy of the good. And we knew that if we tried to recruit just a set of families who promised us to give us information every week indefinitely, that would be a tall order. And at the same time, we knew that there was tremendous value in following as many families as possible as would be willing across time. And so we actually have this hybrid design where when families sign up for the project, we offer them the opportunity to continue to participate indefinitely, and some do, and some will take it once or twice. And then we refill kind of the pool on a regular basis so that we're making sure that we're adding new people in. And so if you think about it, it's sort of like a bridge across time that has some planks that are very long and some that are much shorter, representing people's participation. But if you put them all together, then you can really look at the picture as it's unfolded across time through that combination of data.
Phenomenal. I know that there's been so much attention to the findings of Rapid EC. I've seen it all over the place, of course, within the Twitter sphere as well as on the news media and in the Times, and I'm sure you're swamped with interests that are from so many sectors. Do you have any competitors that are doing similar like surveys?
There are other surveys that have focused on households, and actually many that have focused on childcare providers. Walter Gilliam from Yale, who's associated with 0 to 3, did a very large scale, several tens of thousands of providers back last summer. I think the distinguishing feature about Rapid is its frequency. We knew that when it launched that things would be changing frequently and in a very dynamic way. And there is no question that that continues, even though the pandemic is in a different place than it was. And so there's nobody else that we're aware of who's collecting data as frequently as we are in kind of this holistic picture that's really connected. The other thing that's really, I think, unique about what we're doing is that a large number of the childcare providers that we've been able to recruit into the new survey are providers of families that are in the household survey. And so we have these linked pieces of data where we have families telling us what they're thinking and their childcare provider is telling us what's going on with them. And that's especially given that our childcare provider survey has a large proportion of family, friend, and neighbor and more informal kinds of care. I think it's giving us a much better picture of the landscape as kind of a moving picture as opposed to a one-time snapshot.
Welcome anyone else that wants to join into this conversation with questions. You can raise your hand and we can call on you, or you can add it in the chat. I'm not able to track all of the chat myself, so I hope my colleagues will. But please, any of you want to enter this conversation, please join us. But Phil, the other thing that I'm really curious about is, do you believe that your survey will be able to follow the impact of some of the major national policy shifts? That positive movement in some of the economic hardship responses was interesting to me around the timing. Do you think that there's so much, so many dollars, so many supports, so much movement taking place that families will or will not experience? Do you think that some of your data can help give voice to how the national policy spheres and even state level policy spheres, what families are experiencing of that? What are your thoughts?
It's a great question, David. There are several parts of an answer to this. First of all, we already have some degree of evidence that this is the case in terms of some of the data that I shared during my presentation just now about decreases, about changes in material hardship levels across time. And in particular, since January, with additional stimulus payments coming and with the employment situation improving, the fact that we can see reduction in the proportion of households that are reporting material hardship is some sign of sensitivity of the survey. Another sign of sensitivity of the survey is that in our collaboration with the Riser Network, we saw that in Black households in last May around the murder of George Floyd by the police, that there were increases in the amount of distress that adults who were in Black households were reporting. So I do think there's some degree of sensitivity to kind of national scale events that the survey will pick up on. But the other parts of the answer to this question are, first, that I think since so much policy is made at a local level, that the real ability to detect with the level of granularity that's necessary, the way that changes are going to impact well-being is stuff that we're going to see based on data collection that is more local. So for instance, the amazing bill that passed in Multnomah County that's going to increase the wages of childcare providers, you know, what an amazing opportunity to track what's happening with the childcare workforce and with parents' ability to find quality care for their children in a local environment like that. So I think that's one part. And really, in order to do that, we don't have enough, even with 1,000 participants in the survey per week. We need a much higher rate and a much more selective kind of targeted sampling in order to make conclusions about specific subgroups and specific locations. So we're very eagerly interested in that. We've been talking to Alameda County in California because they have a First Five network there. They're interested. We've had some conversations in Philadelphia. We're doing some such work in the city of Philadelphia. As always, I'll put in a pitch. We would love to do some work with local collaborators here in the state of Oregon. We have the infrastructure. We need partners to make sure the community-based stuff happen, and we need funders that are local funders that see this as a tool. And lastly, what I want to say is that in addition to tracking impact, I think more than anything what this survey does is help us understand needs. If we want to really, if we're serious about equity in providing services, then we need to listen to family voice. We need to listen to childcare provider voice. And I don't think it's enough to have a couple of focus groups to run your ideas by people to get a sense of what they think about your ideas. We have to hear from them about what they want and what they need. And this has become, for me, really one of the things that I want to stake my remainder of my career on, is really using this as a tool for designing programs and for designing policies based on what people are telling us is important to them. I think we really need to flip the script on that, and the opportunity exists.
Here, 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 here. And of course, the crowdsourcing opportunity is really striking of doing that. And I can't help myself but move into the disruption of the chain reaction of hardship, and the observation you had that by families' messagings about their emotional support around them was mitigating. But even more striking was some of the additional information that really we need to pay really close attention to. And you foreshadowed it, but it certainly caught my ear, and maybe all of you, the shift of social networks of support and the way the families themselves described under the pressures and challenges, how they managed their stress was far more local.
Mm-hmm.
Neighborhoods or their families, that sense of turning in to the relational supports that was really made visible. There's something really powerful there that I think is actually a national trend. You know, so much talk about isolation, so much talk about not being connected, and a lot of national conversations about how do we become more connected and more relational. And I was wondering whether did you say that your data could be disaggregated in a way to compare the stress levels to the degree of support?
Absolutely.
Absolutely. And so then again, it elevates for all of us how that voice becomes, I mean, it's self-evident to many of us, but it's really important to make it visible.
Yes.
And to continue to make that visible. But I'm also struck with the local nature of that change. That's telling us societally, I suspect, something really important. And we can go a distance, but how do we begin to message that in terms of our policy development? Now that the Recovery Act is also sending forth community health workers and sending forth the opportunities to have more local networks of people. How do we galvanize that along with what we're learning, Phil, from those in the moment kind of conversations? It's really absolutely striking. It brings then a bigger question that you and I have begun to touch, and that is this tension between toxic stress and mitigating toxic stress by relationships.
Yes.
And as you monitor the field and are aware of the scientific community and the scientific learnings and the like, of going from mitigating toxic stress to resiliency building by relationships, where do you see the science moving? And how do we move from, the sense of damage versus, and those that have been injured forever, to a sense of resiliency in relationships and healing a community and a culture and a people by networks of relationship supports? What are your thoughts, and what's the science telling us?
Well, I'll say a couple of things, and then I want to turn the question back to you, because you are the expert in this area, seriously, and it's important for this audience to hear from you. I mean, so when we looked at the emotional support data, the first week that we collected that data, we found that people were saying that their child was providing them with emotional support and that was helping mitigate some of the hardships. But the question was, well, which child is it? And the logical conclusion that our advisory drew and I drew was, oh, that must mean people are getting their older kids, their teenagers, to help out around the house, to take care of, to babysit if they need to work. Well, I'm sorry to say, for those of you with teenagers and tweens, that it wasn't the older kids. The older kids continue to just do what older kids do, and that's fine. That's their job as adolescents. But parents were not taking additional comfort and finding emotional support in their olders. It was in their infants and toddlers and their preschoolers. That's where the emotional support came from. And so I'd like you to reflect, David. I'm interested in hearing your thoughts about how do we leverage the fact that, at least in households with young children, there's this awareness of what young children can provide, how much more closeness people feel, and how do we extend that to relational health in the context of with childcare providers, with your doctor, with your nurse practitioner, the village that's around the child. How do we kind of leverage the bright spots of this time when we've been more cut off and our networks have become more local, and really continue to build on that rather than just going back to, my coworkers are the people I talk to about, because I spend all my time with them about all the meaningful things in my life. So what's your answer, Dr. Willis?
Well, Dr. Fisher, we can have a good conversation about this, but you teed up a couple thoughts. One, the frameworks analysis study that we did from Pervasiveness support a year and a half ago really gave light to that message, that when one talked in focus groups, affiliate groups with families, one of the key messages they valued about the foundational relationships early was that that it was bidirectional in its meaning and value. So although we in all the health sector and so many in the service sector and the treatment and intervention sector think so much about the impact of promoting strong relationships for the child, that sense of utilitarian sense. In fact, families were saying it's meaningful to me in the moment. And it's meaningful for me itself. Now, there's some growing science there too. Can we see evidence in not only reported mental health, anxiety, depressive symptom improvement related to the relational experience, but there's also physiological data.
Yes.
That we're starting to give rise to, such that a strong relational experience is in fact bidirectional in its impact.
Exactly.
Not only in terms of the well-being of babies, children, toddlers, but also the parents themselves. There's good data that if a family is well supported with not high levels of stress, that some of the historical risks and challenges that a mother or father experiences, there can be mitigation in the positive growing of the relationship itself. So we say, children develop parents too. And, Dr. Watamora's work about looking at brain changes of parents is striking evidence that the brains of us as parents are changing along with the development of our kids. It's a bidirectional process, and that is ever stronger. And there's probably epigenetic changes too there. I've seen some preliminary data that says despite toxic stress impacts on the physiology of a parent from ACEs, there is also some bidirectional evidence that a strong attachment and social network of support around that perinatal period, delivery period, and then that postnatal period, there's also physiological changes in a positive direction in the methylation processes and the like. It's bidirectional. And I'm not a deep scientist, but my interpretation of that is from an anthropological view and from a natural world human development view, there had to be healing forces against trauma in the physiology, or we would have all died out. So there has to be bidirectional healing forces that are deeply relational. But then to hear families say that, Phil, in your survey, that it's actually more the young experiences, I think is capturing natural healing forces in a community, which gives me tremendous hope. Now, then what do we do about that? And so many of us in the child health sector, especially around Reach Out and Read, especially as Reach Out and Read is pivoting to get ever more committed to strengthening relationships foundationally that have benefits for health and well-being, and of course, literacy as that pivot's taking place, aren't we trying to really harness that relationships really matter? And that your relational, those in the moment experiences day by day are actually mitigate the stress we've all been under for both you and families, you and the child. So that public health messaging about the relational power of all of this to counter this moment that we've all experienced, I think can grow. Then Phil, we get to interesting places with your policy team and your advisors, and who's asking about those messaging from the Rapid EC? How are you making visible the relational message of healing in face of what we're witnessing that families are telling us about this important moment for the cultural shift that's taking place? Thoughts?
Yeah, I think, first of all, I want to just acknowledge all that you're saying, and especially with respect to the science. There's no question that there's a growing evidence base about the importance. And I love the idea of it emerging as a bidirectional process. Let me just briefly digress and give you a little bit of science from our own research group. We've been doing a program called Filming Interactions to Nurture Development, or FIND, for a number of years now. It's a very straightforward approach. We film adults interacting with children, so it works with parents or with child care providers. We film them in their natural environment, and we extract these brief clips of what people refer to as serve and return, kind of reciprocal responsive interactions between adults and their offspring, or those in their care. And then we select these clips and we show them back to people. And really all we're doing is extracting these great moments of strong relational interactions happening, as opposed to, I think, the way the field has often approached it, which is trying to teach people new skills or kind of address deficits. So we did a brain imaging study where we did this intervention, the FIND program, with moms with very young children. And we had them do a task in the brain scanner before and after they got the coaching. And the task was a very straightforward task that involved withholding an impulse to push a button when you hear a prompt, when you subsequently hear another one that tells you to stop. So it's basically a measure of physical control that maps onto kind of, can you inhibit responses when you need to? And there's lots of talk about that as one area of so-called executive functioning that's affected by stress and by adversity. Anyway, in the context of just 5 times of showing moms these videos just for a few minutes at a time of themselves, just these extracted great moments of the interaction, we saw improvements in the ability to not push the button. And we saw corresponding changes in areas of the brain related to not only physical, but emotional control. And so I think it's an example of exactly what you're saying, which is that the relational context, especially when it can be made apparent to people what that is, where the golden moments are, where your child is doing something and you notice what they're doing and you acknowledge it or just map onto it, and they see you and you see them, and it goes back and forth. That in those moments, we see fundamental changes happening, not just in terms of children's brain development, but in terms of adults' brain function at points where we're not saying, oh, the brain keeps developing. These are adults in their 20s and 30s. So I think it just gives you, I think, a very hopeful message about the potential. So that's one thing that I think is really critical here is what the science is saying. In terms of getting this information into the hands of policymakers, it's actually related to this last thing that I've been saying. To me, researchers have been showing policymakers and elected officials pictures of brains for decades now, especially when it comes to kids, and it's very compelling. And it tells the story of what happens under unfortunate circumstances and in cases where there's structural racism and inequality. But it doesn't tell you what to do. It gets your attention and it says, here's what happens. And to me, this second part that our survey has been doing is that families will tell you what to do. You don't have to be the policymaker to say, I know, I'm going to cook up this new bill. You need to listen to what people have to say. So when we've been looking at the open-ended responses that our childcare providers have been saying to what would you like people to know who are in elected official positions, they say, I'm worried about my safety. I'm worried about sick leave. I'm worried about the health and well-being of my family members. So if you want to know about what kind of policies to make to protect childcare providers during this time, ask them and they'll tell you. And I think that's the value and kind of the learning that I've taken away from this survey is we don't need to sit back and use our wise minds to think about what we think people need. We just need to ask them and they'll tell us, and then we need to design around that. And so it's really, to me, the bringing together of the brain part. Here's what's happening, and here's what families are telling us, that are really the ways that we think are going to unlock a lot of these levers for what kinds of policies need to be made in the ensuing years to come.
Oh, it's such a parallel process to where the additional work we've been doing about early relational health is listening to families telling us about what matters to them.
Exactly.
And some of the work addressing, bringing video feedback in the moment to families, building off the find, be that through of the Healthy Steps model, like it's happening in Michigan and or in testing in DC, but also using video as a way for families to reflect themselves.
Absolutely.
And to tell their story of themselves in relationship. That captures everything we know of mental health intervention and healing and recovery. Reflection and somebody listening and somebody concurring has tremendous power to be really, I like to think, healing our nation. And that whole sense of movement is happening rapidly. The last thing I would say related to this is the question that Jenny Bass put into the chat. And this is where we can all get a little nervous. And that is related to the question about the impact of facial masks, especially of caregivers or parents or childcare providers and the baby's experience. And certainly there are dialogues going on and questions being asked, and because facial attunement, that facial eye contact interaction, the what's called the object, the writing reflex of looking at faces that babies have, some of that seems to be disrupted when masks are a long period of time. And so there are people asking questions, how do we make certain that there's not an inverted impact on social development related to mask wearing? On the other side of that story is the power of, we're learning also from some, the power of intentional eye contact and facial interaction in play. It looks like you can strengthen and rebuild those elements that are sometimes lost in early development. So it's like, stay tuned, but the sooner we can get masks out of the way in terms of the interactions with babies, especially young babies, it will become really important in our discussions moving forward. There's a lot we don't know yet.
Can I chime in on this one?
Please do.
So there's an old saying in neuroscience that the brain doesn't like to waste good geography. And one of my former colleagues, she's now passed away at the University of Oregon, Helen Neville, did a series of really seminal experiments looking at the areas of the brain that are active when children and adults without sight hear things, and when those without hearing see things. And essentially what she showed was that the sensory areas of the brain become much larger. And for instance, the area involved in vision gets taken over and becomes part of the auditory cortex in people who are blind. And so I want to emphasize, I mean, I don't know of any research at this point that's been done on this topic, but number one, I think we are incredibly adaptive as a species, and we're able to read signals that are subtle. And so if you're deprived of a certain amount of signal, chances are there's some adaptation to the additional signal. I also would just say, to be a little bit more provocative, that the question that's raised by this could be elaborated and shouldn't be that, how are children without sight able to form attachments and learn, how to interact socially if you can't see? And we see no evidence that that's the case. So I just want to emphasize, it's been a terrible time, and masks have been one aspect of the time that's terrible. But I would be much more concerned about deprivation of responsive interaction and relational health than I would be of how much of somebody's physical face you can see. So that's my provocative, slightly cranky response.
Well, it's not cranky, it's hopeful and it's reassuring, and it's also evident by what we all actually know. So we all can get nervous. I do too. We all do. And yet you've got to lean on the resiliency of the brain development and the capacities of resiliency that are built relationally to the
Exactly.
kind of work. So
You're
it's
here.
an exciting time. So I think we're getting close to time. Is that right? And I
Right.
turn back to Lambrina, is that, or to?
To Samira.
Okay.
My
Phil,
better
how much
half.
fun that was. Thank you.
That was great, David. Let's do it again.
Yes, I
That was-
agree.
That was a valuable discussion, and we could have gone on for a long time, but we have to take a 5-minute break. So thank you so much, both of you. This was really rich, and we'll take a 5-minute break from now, and we'll be back in 5 minutes. Take care.
Be well, Phil. Thanks.
You as well. Yeah, my pleasure.
Okay.
And we actually super quick shift. Dr. Fisher, please feel free to get the gift of time if needed. Everyone else, we're going to do one final thing before we take our break. So we're going to have a really quick raffle. It's going to be super exciting. There's going to be sound effects. Thank you so much. There's going to be sound effects. So I'm going to do this super quick and everyone will be able to see it on the screen. So thank you so much to our amazing panel. And right before we take a quick stretch break, coffee break, we are going to do a raffle of 25 books to 2 of today's registrants, thanks to the generosity of All About Books, which is one of our amazing supporters and books distributors. And our team, so ROR Oregon, will be in contact with the winners after the event to get mailing information, etc. So Christine, are you ready? For names, just for that. All right, so here we go. We are going to run the picker wheel. Oh. Can you hear me?
I can hear you. We can't see the wheel.
Oh no. Okay, so my Wi-Fi is frozen and my entire laptop is frozen. So sorry about that.
Maybe we can do the drawing while we take a stretch break.
There we go.
Yeah.
Let's go ahead and take a 5-minute break, and then we'll come back and announce the winners.
Everyone, welcome back. We'll give everybody just a few seconds to regroup from break, finish their stretches, hop back on video as you are able. And Nancy, it's so great to see you. Thank you so much for joining us today. So we are going to, in the spirit of resilience, give the picker wheel one more try in the hopes that the Wi-Fi cyber murder hornets don't interfere. But if they do, the team is ready to keep on moving. So we will give this one more shot. Let me know if you can hear it and see it. All right. So Christina, who is lucky registrant number 52?
You know, this is interesting. It is Martha Lilly from Multnomah County Library, but probably has a lot more than 25 books at her disposal, but she can do with them what she will.
That
They
is
will go to the clinics.
wonderful.
Wonderful. Thank you, Martha.
Martha, thank you so much. That is fabulous. All right, and then we will do one more draw. will tell us who is like you registrant number 37, Dr. Fisher.
I'm going to guess that she's going to say, go ahead and pick another one, because it's actually Taylor from All About Books who's providing the book. So let's give it one more spin.
Fantastic. All righty, here we go. And
all right,
31.
This is pretty amazing. Maybe it's a small group, but Dr. Kate Clayton, our medical director, and you are welcome to give those to the clinics as well if you'd like. Okay, great. Thank you, Lambrina. That was fun. I'll start sharing the screen again and give it over to you, Samira.
Thanks so much. Thanks, Christina.
Welcome back. Thank you. Thank you. And that was fun, Christina, Lambrina. That was really great. So Dr. Clayton and I will move into the celebration part of the program to briefly review the accomplishments of Reach Out and Read Oregon has had over the past year and recognize the community partnerships we have developed. Throughout the pandemic, Reach Out and Read Oregon remained an integral part of pediatric primary care across the state. Despite the many challenges that COVID-19 presented to our partner clinics, their doors remained open throughout the pandemic and families received vital healthcare and continued participation in Reach Out and Read. Because of this unique access point, Reach Out and Read services were provided at over 165,000 well-child visits across the state. The number of clinic sites we partnered with grew to 169, and over 154,000 books were distributed at these partner clinics. We are incredibly grateful to over 1,700 volunteer providers that are dedicated to Reach Out and Read Oregon and see the life-changing effects participation in the program has on the children and families they serve each year. And to you, Kate.
Okay. Additionally, Reach Out and Read has focused on some innovative solutions during the COVID-19 pandemic, and I'm going to review 3 of the projects that we've done over the last year. So first is a book mailing. During the beginning of the COVID pandemic, it became clear to us that while child checks were not able to be conducted in person, Reach Out and Read Oregon offered funding to all 161 partner clinics to ship books to patients missing those in-person well child checks or using a virtual platform for those visits. Over 1,000 books were shipped to children who may not otherwise have received those new developmentally and culturally appropriate books. Thankfully, now we've pivoted back to the traditional in-person Reach Out and Read model, but I was happy that we were able to do that at the beginning of the crisis. Second is the telehealth training and resources. So quickly after the shift to telehealth at the beginning of the pandemic, a new National Center telehealth training video from Reach Out and Read National was produced and provided to all Reach Out and Read Oregon partner clinics. This training modeled how to provide Reach Out and Read during telehealth visits. Although this setting creates new challenges, it also provides the child's physician with really great, unique access point to the family's home and perhaps leading us to offer additional support and services that we may not have known were needed in a traditional clinic setting. And then finally, the third project was the Representation Matters book bundles that we sent out in response to the current racial and social justice movements and the lack of representation of Black, Indigenous, and ethnically diverse individuals in children's books. Reach Out and Read Oregon curated book bundles for each of its partner clinics, highlighting characters and authors of color. The first bundle was shipped in August of 2020, and the next one out in October. Our goal was not only to make clinics aware of the titles available to them and the families they serve, but also to foster conversations amongst the staff themselves about why representation and anti-racist clinic environments matter for children's health. All right, back to you, Samira.
Thank you, Kate. Now I would like to introduce Scott Showalter, CEO of the Oregon Symphony, to discuss our partnership on the second season of Symphony Storytime, a 16-episode educational digital series which premiered on Tuesday, March 16, 2021, featuring Oregon Symphony musicians accompanying the reading of beloved illustrated children's books. Scott became president and chief executive officer of the Oregon Symphony in July 2014, And before moving to Portland, he worked as vice president of the Los Angeles Philharmonic, associate vice president of the University of Chicago, and associate dean of Stanford Law School. Scott, I will give you the floor to talk about our partnership, and we'll show a short clip of one of those amazing storytime videos.
Great, Samir, thank you. Thanks all of you for having me, and moreover for the Symphony's partnership with Reach Out and Read Oregon. I think about our collaboration as a natural one. It may not be evident to everyone, but as reading aloud improves children's health, so does hearing music. Like reading, music has the power to unite, inspire, educate, heal, and bring joy. As children, we learn our ABCs to a tune written by Mozart. And as adults, we mark all major milestones in our lives: birthdays, graduations, weddings, funerals, with words and music. With Reach Out and Read support, we've launched a second season, as Samir was saying, of the digital series Storytime in both English and Spanish, designed for pre-K through elementary age children and their families. These episodes are entertaining and educational, with books narrated by master storytellers and accompanied by musicians performing soundtracks inspired by those stories. This series has gone viral from Africa and India to the UK, Mexico, and across the US. Tens of thousands of people and counting are streaming this content at home and in classrooms. Among our regular viewers is an educational nonprofit for disadvantaged rural youth. One of its teachers wrote to us, quote, "Our children love Tacky the Penguin. Listening to that story with Jatik Clark's tuba engages our kids to learn English and learn music." And this whole series is available for free worldwide as part of Studio 125 on the Oregon Symphony's website. Thanks again for having me. We're looking forward to continuing to work together to improve children's health and well-being through both reading and music.
Hello, and welcome to Symphony Storytime, where we get to share with you two of our favorite things, music and books. I'm your reader, Shalonda Sims, and joining me is a friend from the Oregon Symphony.
Hi, my name is Charlie Renaud. I play the bass trombone, and this is what it sounds like.
Charlie, that was awesome. The trombone is going to be the instrument we use today for our book, The Mitten. Now let's get started. The Mitten, adapted and illustrated by Jan Brett, published by G.P. Putnam's Son. Once there was a boy named Nicky who wanted his new mittens made from wool as white as snow. At first, his grandmother, Baba, did not want to knit white mittens. "If you drop one in the snow," she warned, "you'll never find it." But Nicky wanted snow white mittens, and finally, Baba made them.
Okay. We are just so thrilled to partner with the Symphony Storytimes this year and hope you all have a chance to share these videos with the children in your life. Now I have the honor of introducing our final guest, Nancy Tillman. Born in Birmingham, Alabama in 1954, Nancy spent most of her growing up years in Columbia, Georgia. After graduating from Rollins College in 1976 with a degree in English literature, Nancy co-founded an advertising agency in Dallas, Texas. She left the agency in the early 80s to start a family. And as she often says, I was very fortunate that my husband had a job that let me stay home and raise my children. It's what I dearly wanted to do. Nancy self-published her first book, On the Night You Were Born, in 2005. Her goal with On the Night You Were Born and subsequent books has always been to give parents words to express their feelings of love and belonging to their children. Nancy's illustrations are created digitally using dozens of layers of illustrative elements. These layers are eventually merged to form a composite, at which point texture and media are applied. Thus far, 6 of her books have been in the New York Times bestseller list. Thank you so much for being here, Nancy.
Did I unmute?
Yes, that's
Friends,
perfect.
I am so new to this Zoom world. Can you all hear me?
Yes.
Okay. I am 66 and technology has got the best of me. So I'm going to read this book to you first. This is, you can see it.
Oh, wait. We were going to ask you questions first.
You want to ask questions first? You go ahead. You go ahead.
We're going to end with the book.
All right.
So we asked participants to submit some questions for you today. And thank you to everyone that did submit those. And then we'll have a brief thank you before you read your all kinds of wonderful for us.
All right.
So the first question we received is, what role do you think that books can have in children's lives during these difficult times?
Well, this has been a difficult time. And one of the things I say the most is reading with your children is such an incredible bonding time. There's nothing like it. I mean, you're actually touching your child and they're touching you. And so that's very special. And certainly you can travel to all kinds of places when you're reading a book. Education as well. This book I'm going to read to you in particular is really about how we all are born with our own bells and whistles, and it takes a while to find out what they are, but we each have them.
Beautiful. I know that I found picture books incredibly comforting during this last year with my patients and with my own children. Another one of our participants asked this: what's your favorite children's book from your childhood and why?
It always comes back to Harold and the Purple Crayon. I mean, it was done in 2 colors, but it was so magical to watch him just create his own world with a purple crayon. So my children loved it as much as I did. And that's it. That and Ferdinand. Always loved Ferdinand the Bull.
Wonderful books, wonderful. And I've seen both of those in Reach Out and Read offices. Next question is about the many readings I'm sure you've done at libraries, schools, etc. Do you have a favorite story about a child's reaction or one of their questions that came up during one of your readings?
Well, I have 2. I'll tell you, they're both pretty funny, but one, the children were supposed to raise their hands to ask me questions. And this little boy raised his hand and the teacher called on him and he said, I can do an arm fart, can you? And the teacher was like, oh, I'm so sorry, I'm so sorry. And I would never shame a child. I said, I can't, my son can. And he went, I'll show you. And he just ran up to the front of the room. So that was a great one. And then there was another child that she raised her hand and said, I have a pony. And the teacher said, you're supposed to ask Nancy questions. And so she said, do you have a pony? So children are great. They're so refreshing. And, so those are 2 of my favorite ones.
They are. Those are wonderful. As for the career path that you chose, what inspired you to become a children's book author? Or what is the most rewarding aspect of being a children's book author?
Oh my goodness. For me in particular, my goal is to give parents words to say what they feel about their children. And if a parent tells me I've succeeded in that, that they cry because the words speak their heart, then I feel that I've succeeded. And that's the most rewarding thing to me because then the words become a part of the fabric of that child.
Yeah, I think all of us can echo that you have achieved that very well.
That's what
plenty of tears from me.
That's what I aim to do, I think, is just give parents those words to say. Because children, you know, it's just such a short window of time where you can get all those words into them. As we get older, we put up defenses, you know, we can't always get that. So I just want, they soak them up like a sponge when they're little.
It's true. That's so wonderful and beautiful. I'm going to hand it over to you real quick just to give a thank you, and then we'll have you do a reading.
All right.
Nancy.
Thank you again, Nancy, for your time, for joining us, and for the wonderful insights we just gained about your work and life as a children's book author. In just a moment, I'm going to ask you to take us out with a reading of You're All Kinds of Wonderful. But first, I want to again thank our presenters and guests, Drs. Fisher and Willis, as well as Scott Showalter from the Oregon Symphony. And to all of you who took time out of your busy schedule to spend a couple of hours with us, thank you so much. We cannot provide the critical services we do without support from individuals like you, and encourage you to reach out with any further questions you have. Christina, our development coordinator, will be sending all of you a link of the recording of this event, as well as information on how you can support our work through a donation to the organization. Just $20, yes, just $20 provides the program to one child for an entire year. And now, Nancy, I'm going to bring it back to you. Let us all enjoy the gift of listening to you read You're All Kinds of Wonderful. Wishing all of you and your loved ones health and well-being. Thank you.
All right, I'm on. Everybody can hear
me?
Okay, this is the cover of the book. And this is my granddaughter, Bonnie Jane, who's the inspiration for this. Bonnie has Down syndrome, and I wanted Bonnie to be included. That's a very inclusive book. I always try to show as many different kinds of children as I can. So I'm going to read this for you and hold it up, and hopefully you'll be able to see it. We're not all the same. Thank goodness we're not. Life would be boring, and I mean a lot. And so when we're born, we're supplied at the start with our own bells and whistles to set us apart. Think of your bells as the things you do best, things tucked away in your own treasure chest. When you ring a bell, your heart whistles to it. It's guaranteed every time that you do it. A splendid arrangement. But here is the thing. It takes some practice to make those bells ring. There's lots of advice on the library shelf, like, you're an original, just be yourself. But really, that isn't so easy to do. You have to learn what it means to be you.
This is John.
You'll try some things on that simply don't fit. Don't be discouraged. That's all part of it. And sometimes someone will give you the feeling that his bells and whistles are much more appealing. Look this way, talk this way, be just like me. That's monkey business. Don't eat from that tree. Sooner or later, if you keep trying, you'll try on something that's so satisfying, your heart will start whistling and pow. Bada bing. Ring a ding. Ring a ding. Ring a ding ding. And who knows the bells that are planted in you? Maybe 19 or 102. Before you were born, you were fitted and packed with all kinds of wonderful. That is a fact. Put your hands on your hips and make them both swing. I love kids to do this. What did I tell you? You made a bell ring. Keep putting putting one foot in front of the other, and there is no telling the bells you'll uncover. And can you guess what they add up to? The amazing, astonishing story of you. One morning you'll wake up to find you are grown, and the bells that you've rung and the whistles you've blown will say to the world that the story you told was clever and brave and daring and bold. And I'll be prouder than words can tell of every chapter and every bell. And that's the end of the book, but I always do an afterword, and because I want children to remember it. So I've got here, every time a little bell rings, remember you're filled with marvelous things. That's that book.
Thank you. Thank you. That was wonderful. That was amazing. Thank you all for joining us today, and stay well and stay safe. Until next time.
Until next time. Bye, friends.
Bye. Thank you.
Welcome.